Risk factors for non-organic low back pain in workers' compensation patients. Sometimes a research study accomplishes more than provide information about the topic of interest. It serves as a reminder of current thinking in an area where recent changes have occurred. This is the case regarding the study we will review. What has changed is how the mental health care field perceives and interprets the chronic pain patient. So what is non-organic back pain? What's defined as back pain due to a cause not associated with physical findings that identify a specific structure or physical condition, and it can't be identified on radiography or special imaging. The older terminology often used in referring patients to a mental health specialist was medically unexplained pain. But this terminology and its associated assumptions have been challenged and has been excluded from the new DSM-5. Medically unexplained pain does not exist in the DSM-5. A reminder that the DSM stands for Diagnostic and Statistical Manual of Mental Disorders, the Bible for psychiatrists, psychologists, and mental health care workers. Previously in the DSM-IV, chronic spinal pain that was not medically explainable was termed either as somatization disorder, often associated with depression, undifferentiated somatoform disorder, or pain disorder associated with psychological factors. The dilemma has always been which comes first, depression leading to somatization or body pain leading to depression. The new terminology in the DSM-5 is somatic symptom disorder or illness anxiety disorder. The DSM-5 changes that occurred in 2013 reflect a major shift in the concept of chronic pain. To summarize, the new DSM makes it clear that there are no real differences between mental illnesses and other illnesses. Mental illnesses are medical disorders. Pain caused by mental illness is essentially the same as pain caused by other illnesses, and the focus should shift from what causes pain to whether the patient is responding to the pain in some pathologic or abreactive manner. One of the motivations for this study is that the literature indicates a poor prognosis for surgically managed workers' compensation patients with low back pain. In fact, in one study, only 27% returned to work compared to 67% of those workers who did not have surgery. The researchers were interested in whether there were behaviors or examination clues that might differentiate those who might respond better to conservative care, and their assumption was that those patients would have non-organic pain. The title of the study is Risk Factors for Non-Organic Low Back Pain in Patients with Workers' Compensation, published in the Spine Journal in 2014. This study is a retrospective chart review of 112 work comp patients with low back pain seen by a single spine surgeon over a 2-year period. The researchers focused on looking for which findings were associated with non-organic causes of back pain, including Waddell's signs, and inconsistent behavior, which included inconsistent gait, which was varying the side of limp or guarding, varying areas of numbness, and Hoover's sign. As a reminder, Waddell's signs include an inconsistent straight leg raise, cogwheeling on motor examination, pain with axial compression, pain with light touch, and pain with trunk and shoulder rotation when the back is not rotating. The researchers warned that, quote, although Waddell's signs have been shown to be reliably observable and to predict suboptimal surgical outcomes, they are not proof of malingering or proof of the absence of spinal pathology that can produce at least part of the clinical presentation, unquote. Next, they evaluated whether any of the following are risk factors for non-organic back pain. This included an initial visit to a chiropractor, being a healthcare worker, back pain not listed on the first report, greater than 13 months between examinations, amount of time off of work, number of claims with work comp, present work status, mechanism of injury involving a slip, a fall, or lifting, concomitant psychiatric disorder, legal representation, injury to multiple body parts, and cervical and thoracic symptoms occurring together. All patients who were included in this retrospective study had data on the physical signs and potential risk factors for non-organic pain as part of their files. Also, most of the patients had special imaging. The results are interesting when comparing those with and without indicators of non-organic low back pain. For example, the vast majority of patients, 61.6%, did not have Waddell signs, and only 39.4% had 4 or 5 Waddell signs. And on MRI, it was found that over half of patients, 54.6%, had no indicators for their pain. Also, only one patient with MRI findings had non-organic findings on examination, but 49% of patients with negative MRI findings had non-organic findings on exam. Because this is a retrospective study, cause and effect cannot be studied, and risk is measured with odds ratios. All of the following demonstrated significant association with non-organic low back pain with odds ratios in the 50s. First, a slip, fall, or lifting as the reported cause of injury. Injury to more than one body part, cervical and thoracic complaints together, back pain not on the initial report, and an initial presentation to a chiropractor. But wait, seeing a chiropractor was a risk factor for having non-organic low back pain? Well, not exactly. What it implies is that patients who were eventually identified as having non-organic low back pain statistically were likely to have seen a chiropractor first for their pain. No accusation here, simply an interesting association. Now, let's piece their findings together into what seems a pattern seen by the researchers. Only 22 out of 112 patients had 3 or more risk factors for non-organic pain. 17 of those 22, or 77.3%, were found to have non-organic low back pain findings on examination, and only 4 had pathology on MRI. So perhaps the risk factors correlate with the non-organic low back pain exam findings, and when found may indicate those without MRI findings that would support a structural cause. They found that factors that were not associated with non-organic low back pain included finding a neurologic deficit or MRI evidence of stenosis, disc prolapse, or spondylolisthesis. It appears that the researchers feel there are some recommendations that can be made using the data from their study. Waddell's signs may be used to identify those with non-organic pain, and the patients with organic pain that exhibited non-organic health behavior were often treated successfully with conservative management. Referral of an individual who is unlikely a surgical candidate to a spine surgeon represents use of an unnecessary and potentially risky management approach. So in summary, this is a good study, but with some weaknesses in that it's a retrospective study and a small study with only 112 patients. Yet it does cause us to rethink about not only what to call non-organic low back pain, but also how we might better evaluate patients in the workers' compensation system for deferral to approaches other than surgery.